Yes, my name is Alis Sopadzhiyan. I'm assistant professor at the French School of Public Health in Rennes, in Brittany, in France, and I work within the Department of Human and Social Sciences.
Okay, and how would you explain to a layperson what you do and the type of research and policy work that you do?
Well, I investigate health and social care policies for elderly people in France, and I'm interested in different dimensions of these policies. From policy or decision-making processes on the long run to the implementation of those policies by institutional and also professional actors. And also the third dimension of what I do, it's about people's experience of the system from the user's point of view for both elderly people and their families. Maybe a more specific field of research that I have been developing is policies aimed at improving coordination and integration between health and social care professionals involved in those coordination activities. And I work with other colleagues, with Blanche Tourbillon, that you know, with Arnaud Compéon, with Claude Marlin. And our research also has a comparative dimension as we try to look at what is happening in this field in other countries, in other European countries, and also across the world.
Okay, thank you. So, what would you say are currently the three main policy priorities in terms of long-term care in France?
Well, the President Macron announced that there was going to be a very big reform in long-term care as a part of a bigger consultation process aimed at transforming various public policy sectors. Okay, so the Minister of Health and Solidarities, Agnès Buzyn, named the current President of the High Council for the Financing of Social Protection in France. His name is Dominique Libault. So she named him to investigate on the possible directions of this reform and its precise content. And the results of this investigation were summarized in a report that was issued at the end of March. So this report is very ambitious and defines a series of priorities and measures, such as simplification of the governance and the financing of the different parts of the system, especially for home and residential care, developing quality and freedom of choice in home and residential care institutions, ameliorating care professionals training, increasing the number of professionals and ameliorating their working conditions, including salaries in home and residential care. There is also an announcement of the reform of the existing cash-free care allowance in France, which is name is the personalized autonomy allowance, in order to make respite care more affordable in home care, and also a series of measures to make residential care more affordable. Another important issue is the creation of a special long-term care or fifth social care risk next to the four other risks that already exist within social security systems. And this fifth social care risk would be aimed to finance the risk of loss of autonomy or of autonomy. And of course, the action that is put on supporting informal carers, on better coordination and integration between institutional actors, between the different parts of the system, between professionals, and accent on prevention and awareness about all the issues related to an aging population. And the report was made public once it was validated by the Ministry of Health and Solidarity. But the content of the reform is still to be clarified and defined in the legislation process that is forthcoming in the autumn.
Okay, so all these changes are relatively recent. What would you think how the priorities around the long-term care changed in the last, let's say, 5 years? Do you think there is more priority given to long-term care over the last 5 years?
Mm-hmm. Well, in 2015, there was another law, the law on adapting society to an aging population, and it put the accent on prevention, on the necessity to adopt the environment, the housing, transport for an aging population, on improving home care and also on supporting more actively informal carers. The current reform can be analyzed as the step, second step for changes initiated by this law in 2015. There is clearly continuity between them and in a more general way between long-term care policies in France for the last 10 to 20 years. One might say that the idea to create a new social security risk to finance the loss of autonomy is new, but I would say that there is also continuity with the current systems for two main reasons. The first is because the idea of creating this fifth social security risk has been long discussed since Germany created in the 90s. Germany did their long-term care reform. It has been on the political agenda for a very long time, but the previous governments took the decision to introduce it. And the second reason is that even if the current government decides to create this long-term care risk, it is not going to be a real social security risk, and it is not going to be financed through social contributions or salaries like the other four social security risks. This is not politically acceptable, so it will probably be financed through already existing taxation or any other solution. Yeah, so there is clearly a continuity about this idea too. Nevertheless, I would say that there are several new elements in the political rhetoric about reform in long-term care. First, the report, it is clearly stated that facing the risk of loss of autonomy is a matter of the state, which is already the case in France. As in France, public solidarity is strong. And the objective of this reform is to make this effort, this financial effort, more visible by simplifying the existing policies and sources of financing. So in this report, long-term care is framed as a matter of the state, but also the family, which is why the state needs to support more actively family carers. And also it is a matter of market, because there is a rhetoric about free choice, the free choice argument, and on the necessity to ameliorate to the quality of services. The second element I would like to stress on is accent that is put on the necessity to ameliorate services in both home care and residential care, to ameliorate the professionals' working conditions and training by professionalizing the sector. This had been on the political agenda some years ago, before the reform in the personal sectors, the personal services sector in 2006, and it is again on the political agenda right now. And third, and this is the last point, I would say that there is less dissonance between the objectives of the long-term care reform and the objectives of the reform in the healthcare sector, as far as the objective of the coordination of health and social care is concerned. Traditionally, there have been measures within the long-term care sector to ameliorate coordination within the elderly care system, and then there were other measures in the health policies to ameliorate coordination in the healthcare systems. And now there is less dissonance between the objectives of these two parallel reforms in France, I would say.
Okay. And if you had the opportunity yourself to introduce a new policy in terms of long-term care in France, what would that be and why?
Well, it is more of a research result than a policy recommendation, but it can be turned into a policy recommendation. What we highlight in our work with Blanche Lebihan and colleagues is that yes, it is absolutely necessary to support um, informal carers in their role as they are the pillars for maintaining elderly people in need of care at home, since this is their wish and this is also the less expensive solution for public solidarity compared to residential care. But we should not forget that sometimes the best way to support informal carers is by creating services of good quality and where professionals can work in care in good conditions and for which they have social recognition. So, yeah, this would be my recommendation. There are some elements in the reform that was in the report that was issued on those different points, but results will depend on the various implementation scenarios that are still to be defined in the autumn.
Okay, and as a researcher, and if you talk about research priorities, what do you think is an outstanding piece of research in terms of long-term care in France that would need to be conducted?
Mm. Well, in France, there is more and more attention in France to policies evaluation, to impact assessment, to assessment of the effectiveness, or even the cost effectiveness of policies. This is a good thing as policy evaluation tradition in France is very poor. But I think that this is also a good opportunity to develop critical research on the appropriateness indicators defined for this type of evaluations. These indicators very often hide or simply do not take into account very qualitative aspects of public policy implementations and results. And this is what professionals and also institutional actors say about the way evaluations are being performed right now in France. So, as a researcher and using qualitative methods to analyze implementation of policies, I absolutely agree with them on this point.
Okay, so now I'm going to ask you a few very quick questions, and I'm looking for a number of responses from 1 to 10, where 1 is low and 10 is high. So first of all, what policy priority do you think is allocated to long-term care in France?
Well, this is very difficult to complete, but I will try. I would say from 5 to 7.
Okay.
Long-term care reform right now is clearly on the political agenda, but as are many other reform projects undertaken by the current government in education, in other public services sectors, and so on. So there has also been a very dense social movement, in France that occupies a lot the media arena. Priority given to long-term care in France will be also clarified in the dialogue between the Ministry of Health and Solidarities and the Ministry of Finance for the definition of financing allocated to the reform I was talking about. And this is still forthcoming, so it depends from 5 to 7.
Okay. And how aware do you think is the general public about what the long-term care system can offer to them?
Well, I will be very critical and I will say 3 because the complexity of the French system is such that it is made completely illegible, blurred, and messy to the general public, which explains the reaffirmed objective of this simplification. But I may be too critical.
Okay. And how well do you think the system supports actually people with long-term care needs?
Well, even if the system really is very complex to understand, and it is also very fragmented. Um, Public support to long-term care is quite consistent. So I would say a 6 or 7.
Okay, what about how well the system supports the needs of carers?
Well, progress has been made in this direction since 2010, I would say. The risk again is not to make the whole system depend on informal carers. So I would give a 5.
Okay, and my last question, how integrated are social care and healthcare services in France, do you think?
Well, clearly not much, but there are persistent efforts in this direction. And even if the trajectory of change is very incremental, the direction change is clear. So I would still give a 4 or a 3 or a 5. It depends on where you decide to put the accent on, the efforts or the result.
Okay, well, thank you very much. That was my last question. So thanks a lot for your time today.
Thank you very much, Joanna, for inviting me.